So I work for Wellsbourne Healthcare, CIC, and that's a local GP surgery based in one of the most deprived areas in Brighton and Hove. And I'm one of the focus care practitioners there. Our surgery really prides itself for its holistic approach to healthcare. And we're really passionate about tackling health inequalities in ways that are best suited to the patient. We run weekly activities, for instance, like a drop-in well-being cafe. We also have a gardening project that we have volunteers for, and also we invite patients to attend as well and help out. So my role at Wellsbourne is non-medical, so I'm a focus care practitioner, and again we also take a holistic approach to supporting patients with anything that is non-medical, and it's based around form filling, making referrals to other services or activities in the neighborhood or in the area, as close to the area, and also helping patients improving their personal health care. A lot of our patients disengage with the healthcare system. They have potentially like certain conditions that they need some extra support with, reminders to go to appointments because they don't go to appointments or they don't really engage. So we're there to also encourage them and support them to kind of re-engage with primary care, but also with any other kind of healthcare. So Wellsbourne decided to get involved as I think we were interested in finding ways to improve our evaluation of some of the projects that we run. And I think a large part of our patient group is older, and we find that most of our activities are also attended by older people. And we thought by being part of this project, we could have an input and a say in developing a more kind of user-friendly evaluation toolkit. So that's kind of the main reason why Wellsbourne got involved. I think they had previous experience of working with you or KSS in some format, and they really enjoyed it and found it very helpful, very useful. So hence we got involved with this one. So I didn't get involved at the beginning, but I got involved a little bit later on, but still in the earlier stages of the project. And I suppose my first interaction was attending the consensus building workshop last year. It was early summer. And again, that was a space where me and other organizations were able to kind of input suggestions and needs to ensure that the toolkit is user-friendly. So we were really part of that process of producing the toolkit, but making sure that it included the things that are needed, that we found useful. The later involvement is mainly feeding back on things. So when we were also part of trialing the toolkit itself, and we were able to give feedback to kind of improve the toolkit. So we were able to highlight things that worked and what didn't work, and these suggestions were all actually implemented, which is great. So we intend to use it on some of our projects, as I mentioned earlier. So especially for our well-being drop-in, because that supports mainly older people, and some of the activities that we do in there are very much aimed at older people. So, but also we want to use it a bit more flexibly in the future for our other cohort of patients, and some of our projects do attract a variety of people, different genders, age, and also we want to do some projects with kind of the younger or men only. So we have got lots of ideas, and I think this toolkit will be really useful because we can actually build our own evaluation. And I think that's the beauty of this toolkit, is that you can really pick the things that you deem are important. And although for this one, it's very much aimed at kind of older people, it can actually be adapted to be used for other cohorts of the community, which is great. And it's, and again, easy to use, easy to build as well. The evaluation toolkit is very easy to build if you want to do something completely different as well. The ease of use and navigation of the toolkit, I think that's the main thing. There's a really clear explanation of how to use it. Again, the simplicity of building your own framework, and those are the main advantages for us to be using this toolkit. There's no having to familiarize myself with it for a day or two, or having, it's reading, when you read the guidance, it's all very clear. It's a simple language, and again, you can simply just go through it very quickly and build your own framework, or use what is provided, plus all the resources that are linked in there. Again, that's really helpful for those who want to be a bit more creative and want to know a little bit more and do a bit more fancy stuff. But if you want to keep it very simple and focused, you can do that as well. So I like that in this toolkit. And as Wellsbourne as well. I mean, I'm speaking on behalf of myself, but also for Wellsbourne, so some of my other colleagues who've tried it. I think the main challenge would possibly be for those who are not so tech savvy, those that struggle going online and navigating websites, if that's something that they're not used to. So I'm thinking of maybe if it's a community group of a group of older people who maybe got their first time funding for a project and need to evaluate and feed back to the funder, and trying to use it I would say that's the main difficulty. And maybe other people with certain disabilities, but I'm not sure. Yeah. So from my experience, I would say that it's really good to get involved. You get a chance to have an input into the process as well, and also you can try out like toolkits, like the caveat toolkit. And again, being part of that process has been really helpful for me, and a really good learning experience as well. And I suppose for me, the fact that I was able to have input, and that what I said was also taken into account, and that for me, it makes it feel like it's like co-production. That's why for me this was a very positive experience.